Oral ulcers. So today we will discuss a very common condition that every medical and dental practitioners encounter in a daily practice. That is oral ulcer, right? So an oral ulcer is a break in the continuity of the oral mucosa, resulting in a painful sore inside the mouth, right? Although many oral ulcers are harmless and heal on their own, but some may be the first sign of serious underlying disease like nutritional deficiencies, systemic illnesses, infections, or in some cases, even oral cancer, also, right? Therefore, every oral ulcer deserves a proper history, careful examination, and appropriate management, right? So, a patient will come with a chief complaint of pain inside the oral cavity, and he will say that the pain usually increases while eating, especially spicy food or acidic foods. And the patient may also complain of burning sensation, right? So, always ask about the duration of the ulcer, any history of fever, stress, trauma, or recurrence, right? Because these clues can help identify the underlying causes. Then we will do examination of the patient, and on examination I will inspect the oral cavity carefully, right? And I will look for the number, size, shape, and location of the ulcers. Most benign ulcers appear as round or oval sores with surrounding inflamed mucosa. Also examine the rest of the oral cavity and palpate the cervical lymph nodes if necessary, right? Now let's come to the alarming sign during oral ulcers, right? So if the patient is older age, the ulcer has irregular or rolled margin, right? And if the base is indurated or the ulcer persists for more than 2 weeks without healing, so you should always suspect oral malignancy and must arrange further investigation such as biopsy, etc., right? Similarly, recurrence is also an alarming sign because recurrent oral ulcers may be associated with systemic conditions such as diabetes mellitus, nutritional deficiencies, right? Behçet's disease, or some immunocompromised states also. So these patients require further evaluation, right? Now let's come to the management of oral ulcers. So first of all, we will give antibiotics to the patient. This is prophylactic antibiotics for anaerobes, right? Like tape flagyl 400 milligram, TDS for 5 days, right? Then I will give folic acid and neurobion B complex, that is tab iberate OD, right? Then I will write somogil for pain, TDS. I can also write nelstate or dectane for fungal infection, right? Then I will write PPIs to the patient, that is tabrizec or rolling, which is omeprazole, 20 milligram OD, right? So these are the medications for the oral ulcer. Then regarding the instructions, I will instruct the patient to take good care of his oral hygiene and basically prevent spices also, right? Thank you.